Hey guys, and welcome back. In today's video, we're going to be doing level 0 connective tissue inputs for the rotational movements of the knees. I know that a lot of you might be very unfamiliar with these, and so especially learning to master them and especially starting to improve that knee tissue can have some incredibly powerful and beneficial effects for your body. Like I said, these are going to be level 0, which means that these are going to be the most gentle inputs we can give them while still being effective. So without delay, let's just go ahead and dive right in. We're going to start by warming up our knees by doing a couple capsular knee cars, focusing purely on the rotational element. So within that, what I'm going to have you do is I'm going to have you sit up nice and tall, extend one leg out, bend the other knee up to about a 90-degree angle, start pulling the foot back towards your face. And what we're going to do here is we're going to start rotating back and forth, but we're going to be doing it activating at the knee. A lot of people will start by moving the foot and then the knee will follow. That's fine. However, as you dial this in and you get better at it, I want you to start trying to activate at the knee, and then the foot is just along for the ride. So let's go ahead and do this. Go ahead and bend that knee up. I like to put my hands right here in order to stabilize, or sometimes I'll do a little chokehold to my leg. We're going to do a nice deep breath in. Then we're going to send that foot outward laterally, rotating that tibia. Deep breath in, squeeze it there for 1, and now bring it back across. Deep breath in, and squeeze it there for 1. Beautiful. Let's play with that back and forth. Squeezing outward, 1, 2. Bringing it back across inward. Squeeze it there, 1, 2. If you want to test this, you can put your fingers right here and feel your tibia rotating underneath them. Squeeze it out for 1, 2, 3. Bring it across. Deep breath in and squeeze it there for 1, 2, 3. Final time on this side. We're going to send it outward. 1, 2, 3, 4. And now bring it back across. Deep breath in right here. 1, 2, 3, and 4. Beautiful work there. You can play with that. Now extend that leg out, pull the other one up. Like I say, about a 90-degree angle, bend in the knee. Give it a nice, good, solid squeeze. And now we're going to start playing with this one back and forth. Go ahead and send it outward, squeeze it there for 1. Bring it back across center, squeeze there for 1. Send it outward, deep breath in. 1, 2. Bring it back across the middle. Deep breath in. 1, 2. Send it outward. 1, 2, 3. Back across the middle. 1, 2, and 3. Send it outward. Deep breath in right here and squeeze it as hard as you can. Try and rotate that tibia. 1, 2, 3, 4. Now send it back across to the midline, across the center. Deep breath in right there and squeeze it. 1, 2, 3, 4. Beautiful. Go ahead and give that a little shimmy, a little shake, play with it a little bit, and then we're going to get right into our passive, our passive inputs. So I like to always start with external rotation of the tibia, and what I'm going to do for that is I'm going to bend that knee up to about a 90-degree angle. I'm going to use the same side hand and grab onto this inner edge of my foot. From here, I'm going to slip this arm up under my leg, pop the hand right on the forearm, deep breath in, and then I'm going to start pushing into it, pulling that foot out nice and open. Especially if this is your first time doing it, I want you to go really slow, really gentle, and just feel that knee. All that we're going to do is we're just going to hold this in a nice deep stretch for 2 full minutes. So once again, you can use a nice easy breathing pattern, inhaling through the nose, and then an 8-second exhale through the mouth. Trying to relax that leg, sink into it a little bit more, a little bit deeper. Beautiful. If at any time you need to back out, you can always back out. If you can always try and go in a little bit deeper by creating a little bit more leverage and just allowing yourself to open that knee up. Beautiful work here. Sinking into it deeper and deeper and deeper. Noticing any little places that feel tight, that feel stuck, that feel sticky, and then just sink into them. Once again, if you start feeling a sharp, shooty, pinching pain, we don't push into that. However, if you just feel a nice deep stretch on the opening side of the joint, that's exactly what we want. Beautiful. We've got about 30 seconds left here. Give me another couple deep breaths in. Exhaling, sinking into it. That's it. 5, 4, 3, 2, and 1. We're going to go ahead and release on out of that. Give that knee a little shake, a little shimmy. Hopefully that feels nice and loose and juicy. And we're going to go ahead and switch sides. So go ahead and push that knee out. We're going to bring the other one up. Once again, start rotating it outward as far as you can. Same side hand grabs onto that medial edge. Then we're going to slip this hand up and under, pop it onto the forearm. Deep breath in right there. And now exhale, sink into that stretch, nice and deep. If you want to challenge yourself, you can try either A, pushing the heel out away from you. That's actually going to limit the amount of rotation that knee has. Or if you want to try and go even deeper, you can try pulling that heel in towards you. Once again, I'm going to leave it up to you to find your place of greatest intensity where it feels the absolute gnarliest, and then work from there. For me, I'm going to push my heel out, dial it into the floor, and then really sink into that stretch. Beautiful. Oh, that's my spot right there. 2 full minutes starts now. There it is. Keep breathing. You got just over a minute left. Try and sink a little deeper. Pull yourself even more into that stretch. Find a place that feels, absolutely amazing. And by that I mean it feels like somebody's trying to rip your knee out of its socket. And just sink into it. There we go. 30 seconds left in this stretch. Final breath in. Deep breath in. Exhale slowly. Sink, soften, relax, release into it even more, even deeper for just 5, 4, 3, 2, and 1. Go ahead and release out of that nice and slowly. Oh, that always feels so good to go into and come out of. And now we're going to flip back over to the other side. So we just work on external rotation of each leg. Now we want to do internal rotation as well. So for this one, bring the knee up. We're once again going to spin it inward towards our midline. Then I'm going to use the opposite side hand to grab onto the outer edge of that foot. Same side arm slips up underneath. Once again, we're doing a little figure 4, but we're doing it in the opposite direction. Hand onto the forearm. And then we're going to use that as a crux and a lever to pull ourselves in even deeper. One thing that I found sometimes helps is instead of grabbing the outer edge, sometimes I like to hook onto my big toe here and use that because it also gives me a nice deep stretch into the foot. However, for today, I'm just going to go to the outside edge, latch on there, deep breath in, and then sink into that stretch. One thing that you can do here that also feels really nice is try and spin this femur outward, because either A, we want to rotate that tibia in, or we can also spin that femur outward, and that a lot of times feels really, really good and allows me to get into an even deeper stretch. What I don't want you to do is I don't want everything to collapse over inward. I want you to resist with that hip and then pull into it. Beautiful. 2 minutes, starting now. As always, make any micro adjustments that you might need, especially when you're first feeling this. It can feel very weird, and the body a lot of times doesn't like to allow the knee to rotate to extreme angles, and a lot of time it's just because it lacks training, it lacks, I'll say, resiliency within those ranges of motion. So when we actually allow our bodies to go to those ranges of motion and we hold them there for a long time and we give them the inputs necessary for our tissues to adapt, suddenly those ranges of motion are much less threatening. There it is. Keep sinking into it. A little bit more, a little bit deeper. That's it. Keep locking it down. About 45 seconds to go here. Amazing work, guys. Keep pulling it in. See if you can find just another millimeter, another 2 millimeters. Sink into it a little bit deeper, a little bit more. That's it. 15 seconds. Inhale. Exhale slowly. Sink, soften, relax, release. Come into it a little more, a little deeper. Find the absolute edge and then hold there for 5, 4, 3, 2, and 1. Slowly, you can come on out of that, nice and gentle. Give that knee a little play, a little work around with it. Woohoo! And we'll be right on to the other side. So once again, we're gonna bring that knee up to about a 90-degree angle. We're gonna internally rotate it as much as we possibly can. Same side hand grabs onto the foot. Opposite hand grabs onto the foot. Same side arm comes up under, latches onto the forearm, and then we just slowly use that action to start pulling it in deeper. Beautiful. Find the right position for you. On this side, I'm gonna drop down to my big toe and use that as my lever. And our 2 minutes starts now. Sometimes, even when it feels really good, I'll even use this inside or this same side hand to grab onto the foot and use that to wind it even deeper, even more. There it is. Amazing. Just about a minute left. Keep sinking into it. Use your breath. Pull it deeper, stronger, tighter. That's it. Almost there. 30 seconds to go. Don't you quit now. Beautiful. 5, 4, 3, 2, and go ahead and release it on out. Nice and slow and gentle. You can play with it a little bit. Amazing. All right, now we're gonna finish this off with just four knee cars on either side. Once again, going rotational. Deep breath in, pull that foot towards the back of the face, or towards your face. Now we're gonna send it outward laterally. Deep breath in, squeeze there. And now bring it across nice and slow. Squeeze there. Send it lateral, squeeze, 1, 2. Bring it across the midline, 1, 2. Send it out, squeeze it as hard as you can, 1, 2, 3. Bring it across the midline, squeeze there, 1, 2, 3. Final time here. Send it lateral, deep breath in and squeeze, 1, 2, 3, 4. Bring it across, deep breath in and squeeze, 1, 2, 3, and 4. Beautiful. Relax that knee on down. We're going to bring the other one up. Once again, right here. Go ahead and send it lateral. Squeeze it there for 1. Bring it across. Deep breath in. 1. Send it lateral and squeeze it as hard as you can. 1, 2. Bring it across the middle and squeeze there. 1, 2. Send it lateral. 1, 2, 3. Across the middle. Deep breath in. 1, 2, and 3. Send it lateral. Final time. Deep breath in. 1, 2, 3, 4. Bring it across the midline. Deep breath in. 1, 2, 3, and 4. All right, there we go. Amazing work, guys. So like I said, these are level 0 connective tissue inputs for the knees. Once again, these are the most gentle inputs you can give your body while still being effective and creating actual deep change within the biological tissues that determine everything that you're capable of doing. If you can do this particular series, I would say anywhere between 3 to 4 times per week, and do that for 1 full training cycle, which is 6 to 8 weeks, you will see massive improvements. Once again, thank you guys so much for being here with me. I'll see you guys in the next one.